Hi everybody. We're going to talk about the basics of gum health and how brushing and flossing habits can have an effect. So let's start from the beginning. There's a tooth, and here's bone, and here are the gums. What I've drawn here is very healthy and easily maintainable, meaning that the bone is in very good shape, the gums are very shallow and easy to clean, and that means that if a piece of food gets stuck below the gum tissue on a tooth, it's going to be very easy to remove that food with a toothbrush or with a piece of floss or some other method. In this situation, what I've drawn right here, this would be considered healthy. We have a piece of food. In this situation, the gums shouldn't bleed, especially when we brush, and there should be no pus coming out of the gums either. If that piece of food is left on the tooth and it's not cleaned either with a toothbrush bristle, with bristles of a toothbrush, or with a piece of floss or some other method, then bacteria that live in our mouth begin to eat the food as a source of nutrients, and they begin to multiply and divide. When that happens, the food changes and it starts to become a sticky substance that releases toxins and poisons into the environment. At that point, the food is no longer called food. Now, with its toxins, it's called plaque. Plaque is very irritating to our gums, and the body knows how to deal with that irritation in only one way, where it tries to fight the irritation and remove the toxins and remove the poisons and kill the bacteria by sending blood cells to the area to fight those toxins. When that occurs, the gums get swollen with those extra blood vessels, and at this point now, the gums could bleed even when we brush and floss, but we wouldn't have any pus coming out of the gum tissue. This stage would be called gum disease or gingivitis. It's important to understand that if the food is removed from the tooth structure or the plaque is removed from the tooth structure effectively with toothbrushing or flossing, then this can never occur, and the gums would heal up to go from gum disease and gingivitis where they bleed to go to a healthy situation where there's no longer any bleeding. And through our program and through our training, we're able to effectively help people understand the best methods of brushing and flossing to be able to remove food and plaque from the tooth structure. One last note, one of the reasons why our program is so effective is because many times we have people that are brushing and flossing their teeth, and the bristles of the toothbrush, they might be brushing and flossing multiple times a day. If the bristles of a toothbrush are hitting their tooth structure here, but the food is getting stuck here, then this process will occur. And this is how gum disease progresses into eventually periodontal disease. For more information about how the progression occurs, you can refer to some of our other videos here on our site, regarding the progression of periodontal disease. Thanks for joining us.